Doctor, good to see you. Thanks for your time this morning. Before we do get on to medical matters, I've got to ask you about that Trump's social media ban has been upheld for now. Are you pleased about that?
I would prefer not to comment about that. That's out of my lane, as it were.
Okay.
Sorry.
Well, I mean, I only asked because you worked with him for so long and obviously had differing views. The fact that those views aren't going to be aired publicly for another 6 months or so, I thought you might have something to say about it.
I do, but I'm not going to.
Okay, fair
Sorry.
enough. Let's go to vaccines then, Doctor. Australia has administered 2.4 million vaccinations so far. That's less than what the US is administering every day. Is that a failure of our vaccination program?
No, I really wouldn't call it a failure, because what you need to do, and I'm sure that the Australian authorities are working on this, is to figure out ways to get a good flow of vaccines into the arms of people. When we started off right away in December to try and vaccinate people, we did not have a comprehensive plan about getting it into the community level. Once you get a good plan going, you'll see that the rate of daily vaccinations will go up. Yeah, I think it's probably too early to say it's a failure or not. I think it obviously needs to have some course corrections, but I would give them the opportunity to do that before I would call it a failure.
Should we at least have secured more doses from different manufacturers earlier?
I keep getting asked that question. It's sort of like what we call in the United States in Monday morning quarterbacking. I mean, you could have or should have. When things aren't working as well as you'd like, you could always outguess yourself and said, should we have had more irons in the fire? In the United States, we did take that step, and that's the reason why we partnered with 6 separate companies for 3 separate platforms: the mRNA, the adenovirus, and the soluble proteins. And we did that because we felt we wanted to make sure we had good backup in case anything went wrong.
What was the advice that you gave President Biden as India's case numbers started to explode?
Well, I mean, I wasn't the only one. I was public about it. I don't like to talk about my private advice to the President of the United States, but I publicly have said that we should do whatever we possibly can to help India. And we have. I mean, we've now brought oxygen cylinders, oxygen generating machines, personal protective equipment, material to be able to make vaccines in India, a variety of other things, drugs like remdesivir. And we very likely will be sending doses of vaccine from our own store of vaccines. So that was my recommendation publicly about what we should do. In fact, that is what we are doing.
You are allowing American citizens to return home as well. Was it ever on the cards to stop all flights and stop all people from returning from India?
No, you really can't. It's very difficult to do that according to our own laws and our own tradition, to ever prevent American citizens from coming back into the country. So I don't think that was ever a consideration. You're obligated to receive your own citizens back in the country. So we never really seriously discussed a complete block of all people coming from India.
Australia has suspended all flights temporarily, plus it threw in a threat of jail time and big fines for anyone who tried to reach Australia through a third country from afar, from where you are. How does that sound to you?
Well, it sounds like the Australians are very, very serious about not letting people into the country who might be risk in the sense of spreading infection. I don't really want to criticize what Australia has done. They generally have handled the outbreak really quite well with some significant success. So I don't think it's appropriate for me to be making any critique of a policy of Australia.
Okay, but would it be a surprise to you that such action would have been taken when our quarantine system had been going reasonably well?
Yeah, again, I don't want to try and outguess the Australian authorities. If I were there, living there, observing on a daily basis what went on, I would be more than happy to discuss it with you, but I don't want to just come in from the outside and be critical of the Australian authorities.
Okay, what about the Indian authorities? Are you surprised that India hasn't gone into a full national lockdown?
Well, I have recommended publicly in various interviews on more than one occasion that they should lock down. I don't think, I mean, there's always a reluctance to lock a country down. I'm not talking about locking down for 6 months. I'm talking about locking down temporarily for a few weeks to try and interrupt the cycle and the chain of transmission. I believe if they do that and interrupt, at least partially, that chain of transmission, they could then start getting on track of getting even a better control of the outbreak. So I have recommended that publicly to them on a couple of occasions.
Here in Australia, we have some of our state premiers who shut down borders and their own economies after just one case is recorded. Does that sound like an overreach to you, bearing in mind that you're dealing with some 50,000 new cases every day still?
Well, you know, shutting down is always a painful thing. I mean, when we shut down partially, we never really shut down completely. There was always some activity going on. When we shut down partially, there was a lot of pushback from people because of the potential economic repercussions of that. It's not something easy, but occasionally you really have to do it if you want to interrupt the chain of transmission.
You want to have at least 70% of Americans to be vaccinated by July 4. Is that at about the point that you think you'll reach herd immunity?
You know, herd immunity is an elusive concept. I mean, there's the concept of herd immunity, which means you get enough individuals vaccinated plus the number of people who are infected, recovered, and now have durable immunity. And the combination of that two leads to a blanket or a veil of protection where the virus has no place to go because they can't find, or it's difficult to find, susceptible subjects. That is the concept of herd immunity. The threshold of herd immunity, namely what the number is, what percentage that is, we do not know the answer for SARS-CoV-2. We know the answer for measles because we have decades of experience with measles, but we don't know what it is for SARS-CoV-2. So rather than chase an elusive number that we're not sure of, I've always said and continue to say that the best thing to do is to vaccinate as many people as you possibly can, as quickly as you possibly can. I made a guesstimate that the number would likely be somewhere around 70 to 85%. I believe that the president's goal of 70% of Americans getting at least one dose by the 4th of July is a challenging goal, but I believe it's doable, and I believe we will be successful in reaching it.
Do you think boosters are going to be needed every year?
I think it is entirely conceivable that we will need to boost, not necessarily every year, but we may need to intermittently boost to keep the level of the duration of the protection high enough to be over the baseline critical level below which you can wind up getting rebounding of infection. So I think it's quite conceivable that we will need boosters at some time.
Okay, I've just got two more questions, Doctor. The US still hasn't approved AstraZeneca. It is available for those aged over 50 here. Do you back it?
Well, I'm waiting for our FDA, our regulatory body, to look at the data and to make a determination as to the safety and the efficacy. Interestingly, AZ has not yet submitted that data to the FDA. So it isn't that the FDA is delaying making a decision. It's that the company has not yet submitted the information that's needed to get an EUA.
And just finally, what is the biggest challenge that we all face over the course of the next year?
I think the challenge that we face is to get as many people vaccinated as we possibly can. You know, there is this element of vaccine hesitancy among some people who don't want to get vaccinated for one reason or other. I think it's critically important that we reach out to them, not in a finger-pointing way, but in trying to get them to understand why it's important for their own health, for the health of their families, and for really the societal responsibility of the health of the community. If we can get those people vaccinated, we'll be in good shape.
And what about transmissible variants?
Well, obviously, there's always something that you have to be concerned about. You have to keep your eye out on it. The best way to prevent variants from emerging is to stop the virus from replicating. The best way you stop the virus from replicating is by vaccinating as many people as you possibly can.
Okay, Dr. Anthony Fauci, it's been a pleasure talking to you. Thanks for joining us here this morning.
Thank you for having me. Good to be with you.